Assalamu alaikum students. Today the topic of our essay is COVID-19 and mental health issues. How to cope with mental health issues during COVID-19 pandemic, or COVID-19 and its effect on mental health. So first you will give the introduction of the topic, you will discuss the main idea, you will discuss about the coronavirus itself, that as it is rapidly spreading across the world, it is inducing a considerable degree of fear, worry, concern among the common public, and especially the older adults. It is a cause of phobias, fears, social isolation, depression, anxiety, and stress. So mental health, you can say, is elevated due to COVID-19 and its effects. So one reason of this fear, anxiety, stress is that is the fear of catching the virus itself. People are afraid of becoming infected with the virus. But another reason is the great changes, the great number of changes this virus has brought in our living styles. People are suffering due to, at all levels from these problems at all levels. By at all levels, I mean, you can write in the second paragraph the effect of coronavirus on different categories of people. No one is there who is not left unaffected. Even the children, younger children, they feel deprived of physical contact with their fellow children. They are not going to school, and they are you can say their interaction, their games, and other activities with which they used to indulge with age fellows are restricted. And because people are afraid the children might not contract the disease, so they are also homebound, and they are also suffering from isolation and anxiety, stress. Even children suffer from depression. So teenagers are already undergoing through a developmental phase, and their problems are already even in normal conditions, their teenagers are a difficult, you can say, already group to understand and to deal with. So now, as the present pandemic has made them homebound and restricted, and their school is off, they're also undergoing a great amount of stress, and especially the excessive use of gadgets, mobile phones and laptops and TV, they have further made them aggressive, and they can also suffer from depression, anxiety, stress. So college going and university students, these are the students whom I'm dealing with, and I can see that they are undergoing great stress. They are panicked stricken, because they are worried about what is going to happen about their future, what will happen next, and how and when their exams will be held, and what about their next course, and how will they finally achieve their goals and admissions and everything. So they are very much panic stricken, undergoing great amount of anxiety. They also need counseling. They need somebody to tell them that it's not the end of the world, they should hope for the best. And these students also need guidance and support, mental support. They are unable to concentrate on their studies, they are unable to plan how they are going to prepare, they are unable to prepare, but they are just concerned with how and when their exams will be held. And jobians, they have never, this category of students are more worried about online exams, because they have not experienced it before. Jobians are also undergoing stress, because their working routine has been disturbed, and they are also afraid of contracting the disease, because they have to really go out for their work. And jobless persons, this category, and E and F category, these are the categories of people who are undergoing extreme stress, and their situation is very difficult. The people who have become jobless because of the virus, and they are facing financial issues, they are going extreme level of stress, and unfortunately this is the group which is committing suicides as well. And people working in health sectors, especially those who are caring after COVID-19 patients, they are also undergoing extreme stress and undergoing extreme anxiety, because their job is also very tough and very stressful. the population, the elderly population comprised of adults aged 60 and above. They are also undergoing stress due to the current pandemic, because they are more at risk. Their immune system becomes weak, and it is very dangerous for them to contract the disease. Most of our elderly population are homebound now. They were already restricted to their homes, but now they are further limited, because they cannot go out for prayers and other activities, because there is a looming fear of their contracting the disease. And they are also suffering from some sort of, you can say, deprivation, isolation, and physical, you can say, social, socially they are very much deprived and isolated. People are already suffering from pre-existing mental issues. So there were people who were already suffering from some kind of mental issues, and their issues have been aggravated by the current pandemic, because these people were already sensitive, and now the current situation, which is so stressful and so you can say stressful and so overwhelming, that they have become, their mental issues have further aggravated, and they cannot go for their regular visits to their mental supporters or the doctors. So their visits are disrupted. Poor, low class, homeless people, they were already this class was already the suffering class, and now there is an addition of a large number of people among the poor and lower class and the homeless and the beggars, because many poor people who were already poor have now further become unemployed, and there is no source of earning for them. So there is an increased number of beggars, increased number of homelessness, and other issues, you can say financial issues. So people infected with the coronavirus are another category of people who are undergoing stress, anxiety, social isolation, depression, because they are either infected from the virus or who have undergone through the infection. They feel socially deprived. They have a fear, or their immune system becomes weak, and they are afraid of catching the virus again, and their mental and physical health both has deteriorated because of coronavirus. And then there are the psychological effects of COVID-19, phobias and their types. Phobia of catching the virus, ourselves and of our loved ones, and something happening to our loved ones, fear of death, fear of being infected, fear of other and you can say things, unexpected things. Phobias मज़ीद बढ़ गए हैं कि इधर टच ना करें, उधर टच ना करें, इधर ना जाएं, उधर ना जाएं. So people have become very much phobic as well. Anxiety and stress of the unknown, stressful situation देख के, it gets stressful news सुन के. So everybody is undergoing through anxiety and stress, almost majority of the people, you can say. Emotional gap है, social gap है, emotional isolation है. There is people find themselves isolated, lonely. They have got no one to talk to. Relatives के लिए visit करना एक दूसरे को मुश्किल हो गया है. Friends को visit करना मुश्किल हो गया है. Social gatherings नहीं हैं. People are undergoing isolation. सो डिप्रेशन की भी बहुत सी टाइप्स हैं. डिप्रेशन इज सिचुएशनल डिप्रेशन के अभी जो प्रेजेंट सिचुएशन है उसको देखते हुए लोग अक्सर जो हैं डिप्रेस्ड हो गए हैं. दैट इज़ टेम्प्रेरी सॉर्ट ऑफ डिप्रेशन के न्यूज़ सुन के, सारी हालात देख के पीपल आर डिप्रेस्ड. प्री एग्जिस्टिंग डिप्रेशन पहले से लोगों में था मौजूद, वो अब मज़ीद एग्रोवेट हो गया है. माइल्ड डिप्रेशन कुछ लोगों को होता है, उन्हें पता भी नहीं होता है कि दे आर सफरिंग फ्रॉम इट. उनके लिए डेली रूटीन के काम करना मुश्किल हो रहा होता है. गेटिंग अप एंड चेंजिंग क्लोथ्स एंड मीटिंग पीपल, और डेली रूटीन के काम करना ही जब मुश्किल लग रहा होता है. इवन द कोम्बिंग आर हेयर और अपने आप को ठीक करना, दैट इज़ एन इंडिकेशन ऑफ माइल्ड डिप्रेशन. ये मेजॉरिटी को है भी تو انہیں پتہ نہیں ہوتا. اسمائلنگ ڈپریشن, دیر آر سم پیپل ہو آر ڈپریسڈ ان سائڈ بٹ دے پریٹینڈ ایز اف دے آر ہیپی. سو ایسے لوگوں کو کی بھی بہت مشکل ہوتی ہے, اور ایسے لوگ بھی اچانک ان کا, کیونکہ دے ریفیوز ٹو ٹیک اینی کائنڈ آف ہیلپ, دے ریفیوز ٹو ایکنالج دیئر کنڈیشن, ان کا یہ سویئر ڈپریشن کی طرف بھی لیڈ کر سکتا ہے. اینڈ سرپرائزنگ ہو جاتا ہے لوگوں کے لیے وین سوسائڈل تھاٹس فائنلی آتی ہیں, اور مزید سچویشن جب ان کی ورس ہوتی ہے تو دے بیکم سوسائڈل. سو دیز آر سم یو کین سے psychological effects